Hey, Alphanesses. I'm Licensure from alphanesses.com. This is hypertension questions. What are they? Let's get started.
The nurse teaches a client who has recently been diagnosed with hypertension about following a low-calorie, low-fat, low-sodium diet. Which of the following menu selections would best meet the client's needs? 1. Mixed green salad with blue cheese dressing, crackers, and cold cuts. 2. Ham sandwich on rye bread and an orange. 3. Baked chicken, an apple, and a slice of white bread. 4. Hot dogs, baked beans, and celery and carrot sticks. The correct answer is 3. Processed and cured meat products, such as cold cuts, ham, and hot dogs, are all high in both fat and sodium and should be avoided on a low-calorie, low-fat, low-salt diet. Dietary restrictions of all types are complex and difficult to implement with clients who are basically asymptomatic. A hospitalized client who is being treated for hypertension with furosemide, atenolol, and ramipril develops a second-degree heart block Mobitz type 1. Which of the following actions should the nurse take? 1. Administer a 250 milliliters fluid bolus. 2. Withhold the atenolol. 3. Prepare for cardioversion. 4. Set up for an arterial line. The correct answer is 2. The client may be asymptomatic and the underlying cause should be assessed. Drugs that block the AV node should be avoided, such as beta blockers, calcium channel blockers, digoxin, and amiodarone. Symptomatic clients are treated with atropine and transcutaneous pacing. There is no indication for a fluid bolus, cardioversion, or arterial line. A client who has diabetes is taking metoprolol for hypertension. Which of the following information should the nurse include in the teaching plan? Select all that apply. 1. These tablets should be taken with food at same time each day. 2. Do not crush or chew the tablets. 3. Notify the healthcare provider if pulse is 82 beats per minute. 4. Have a blood glucose level drawn every 6 to 12 months during therapy. 5. Use an appropriate decongestant if needed. 6. Report any fainting spells to the healthcare provider. The correct answers are 1, 2, 4, and 6. Metoprolol is a beta-adrenergic blocker indicated for hypertension, angina, and myocardial infarction. The tablet should be taken with food at the same time each day. They should not be chewed or crushed. The healthcare provider should be notified if pulse falls below 50 for several days. Blood glucose should be checked regularly during therapy, since increased episodes of hypoglycemia may occur. It may mask evidence of hypoglycemia, such as palpitations, tachycardia, and tremor. Use of any OTC decongestants, asthma and cold remedies, and herbal preparations must be avoided. Fainting spells may occur due to exercise or stress, and the dosage of the drug may need to be reduced or discontinued. Metoprolol is added to the pharmacologic therapy of a diabetic female diagnosed with stage 2 hypertension, initially treated with furosemide and ramipril. An expected therapeutic effect is 1. Decrease in heart rate. 2. Lessening of fatigue. 3. Improvement in blood sugar levels. 4. Increase in urine output. The correct answer is 1. The effect of a beta blocker is a decrease in heart rate, contractility, and afterload, which leads to a decrease in blood pressure. The client at first may have an increase in fatigue when starting the beta blocker. The mechanism of action does not improve blood sugar or urine output. A client diagnosed with primary hypertension is taking chlorothiazide. The nurse determines teaching about this medication is effective when the client makes the following statement. Select all that apply. 1. I will take my weight daily at the same time each day. 2. I will not drink alcoholic beverages while on this medication. 3. I will reduce salt intake in my diet. 4. I will reduce my dosage if I have severe dizziness. 5. I will use sunscreen if I have prolonged exposure to sunlight. 6. Take the drug late in the evening. The correct answers are 1, 2, 3, and 5. Chlorothiazide causes increased urination and decreased swelling and weight loss. It is important to check and record weight 2 to 3 times per week at same time of day with similar amount of clothing. Clients should not drink alcoholic beverages or take other medications without the approval of the healthcare provider. Reducing sodium intake in the diet helps diuretic drugs to be more effective and allows smaller doses to be taken. Smaller doses are less likely to cause adverse effects, and hence excessive table salt, as well as salty food, should be avoided. Chlorothiazide is a diuretic that is prescribed for lower blood pressure and may cause dizziness and faintness when the patient stands up suddenly. This can be prevented or decreased by changing positions slowly. If dizziness is severe, the healthcare provider must be notified. Diuretics may cause sensitivity to sunlight, hence the need to avoid prolonged exposure to sunlight, use sunscreens, and wear protective clothing. Chlorothiazide causes increased urination and must be taken early in the day to decrease nighttime trips to the bathroom. Fewer bathroom trips mean less interference with sleep and less risk of falls. The nurse is developing a care plan with an older adult with hypertension and is instructing the client that hypertension can be a silent killer. The nurse should instruct the client to report signs of which of the following diseases that are often a result of undetected high blood pressure. 1. Cerebrovascular accidents. 2. Liver disease. 3. Myocardial infarction. 4. Pulmonary disease. The correct answer is 1. Hypertension is referred to as a silent killer for adults because until the adult has significant damage to other systems, the hypertension may go undetected. CVAs can be related to long-term hypertension. Liver or pulmonary disease is not generally associated with hypertension. Myocardial infarction is generally related to coronary artery disease. A client is taking clonidine for treatment of hypertension. The nurse should teach the client about which of the following common adverse effects of this drug. Select all that apply. 1. Dry mouth. 2. Hyperkalemia. 3. Impotence. 4. Pancreatitis. 5. Sleep disturbance. The correct answers are 1, 3, and 5. Clonidine is a central-acting adrenergic antagonist. It reduces sympathetic outflow from the central nervous system. Dry mouth, impotence, and sleep disturbances are possible adverse effects. Hyperkalemia and pancreatitis are not anticipated with use of this drug. The client has had hypertension for 20 years. The nurse should assess the client for 1. Renal insufficiency and failure. 2. Valvular heart disease. 3. Endocarditis. 4. Peptic ulcer disease. The correct answer is 1. Renal disease, including renal insufficiency and failure, is a complication of hypertension. Effective treatment of hypertension assists in preventing this complication. Valvular heart disease, endocarditis, and peptic ulcer disease are not complications of hypertension. An older adult with a history of hypertension is admitted with diagnosis of dehydration. The client is becoming increasingly confused and weak. The client reports taking 1 tablet of hydrochlorothiazide daily, and the prescription is written for 1/2 tablet. The nurse should obtain additional information about 1. Decreased drug half-life of the hydrochlorothiazide. 2. Decreased hepatic blood flow. 3. Increased GI activity. 4. Increased urinary elimination. The correct answer is 2. Aging causes decreased hepatic blood flow. Decreased drug metabolism, which occurs with aging, along with more drug in circulation, means the drug will remain in the body longer and produce greater drug effects. The client has also taken more drug than prescribed, increasing the opportunity for more drug action to occur. When there is decreased metabolism of drugs, an increase in the half-life will occur most especially in the older adult. In older adults, transit time is slower, allowing more drug to be absorbed. Increased urinary elimination would mean that drug elimination could be higher, not lower, and accumulating in the body. A client with hypertensive emergency is being treated with sodium nitroprusside, nipride, in a dilution of 50 milligrams per 250 milliliters. How many micrograms of nipride are in each milliliter? Blank micrograms. The correct answer is 200 micrograms. First, calculate the number of milligrams per milliliter. You do this by dividing 50 by 250, which equals to 0.2 milligrams. So it's 0.2 milligrams per 1 milliliter. 1 milligram equals to 1,000 micrograms. So you multiply 0.2 milligrams by 1,000, which equals to 200 micrograms. When teaching a client about propranolol hydrochloride, the nurse should base the information on the knowledge that propranolol, 1. blocks beta-adrenergic stimulation, and thus causes decreased heart rate, myocardial contractility, and conduction. 2. increases norepinephrine secretion, and thus decreases blood pressure and heart rate. 3. is a potent arterial and venous vasodilator that reduces peripheral vascular resistance and lowers blood pressure. 4. is an angiotensin-converting enzyme inhibitor that reduces blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2. The correct answer is 1. Propranolol is a beta-adrenergic blocking agent. Actions of propranolol include reducing heart rate, decreasing myocardial contractility, and slowing conduction. Propranolol does not increase norepinephrine secretion, cause vasodilation, or block conversion of angiotensin 1 to angiotensin 2. The nurse is discussing medications with a client with hypertension who has a prescription for furosemide daily. The client needs further education when the client states which of the following? 1. I know I should not drive after taking my Lasix. 2. I should be careful not to stand up too quickly when taking Lasix. 3. I should take the Lasix in the morning instead of before bed. 4. I need to be sure to also take the potassium supplement that the doctor prescribed along with my Lasix. The correct answer is 1. Furosemide is a diuretic often prescribed for clients with hypertension or heart failure. The drug should not affect a client's ability to drive safely. Lasix may cause orthostatic hypotension, and clients should be instructed to be careful when changing from supine to sitting to standing position. Diuretics should be taken in the morning if possible to prevent sleep disturbance due to the need to get up to void. Lasix is a loop diuretic that is not potassium sparing. Clients should take potassium supplements as prescribed and have their serum potassium levels checked at prescribed intervals. The client realizes the importance of quitting smoking, and the nurse develops a plan to help the client achieve this goal. Which of the following nursing interventions should be the initial step in this plan? 1. Review the negative effects of smoking on the body. 2. Discuss the effect of passive smoking on environmental pollution. 3. Establish the client's daily smoking pattern. 4. Explain how smoking worsens high blood pressure. The correct answer is 3. A plan to reduce or stop smoking begins with establishing the client's personal daily smoking pattern and activities associated with smoking. It is important that the client understands the associated health and environmental risks, but this knowledge has not been shown to help clients change their smoking behavior. In teaching the client with hypertension to avoid orthostatic hypotension, the nurse should emphasize which of the following instructions? Select all that apply. 1. Plan regular times for taking medications. 2. Arise slowly from bed. 3. Avoid standing still for long periods. 4. Avoid excessive alcohol intake. 5. Avoid hot baths. The correct answers are 2 and 3. Changing positions slowly and avoiding long periods of standing may limit the occurrence of orthostatic hypotension. Scheduling regular medication times is important for blood pressure management, but this aspect is not related to the development of orthostatic hypotension. Excessive alcohol intake and hot baths are associated with vasodilation. Which intervention would be most likely to assist a client with hypertension in maintaining an exercise program? 1. Giving the client a written exercise program. 2. Explaining the exercise program to the client's spouse. 3. Reassuring the client that he or she can do the exercise program. 4. Tailoring a program to the client's needs and abilities. The correct answer is 4. Tailoring or individualizing a program to the client's lifestyle has been shown to be an effective strategy for changing health behaviors, providing a written program, explaining the program to the client's spouse, and reassuring the client that he or she can do the program may be helpful, but are not as likely to promote adherence as individualizing the program. The nurse is teaching a client with hypertension about taking atenolol. The nurse should instruct the client to 1. Avoid sudden discontinuation of the drug. 2. Monitor the blood pressure annually. 3. Follow a 2-gram sodium diet. 4. Discontinue the medication if severe headaches develop. The correct answer is 1. Atenolol is a beta-adrenergic antagonist indicated for management of hypertension. Sudden discontinuation of this drug is dangerous because it may exacerbate symptoms. The medication should not be discontinued without a physician's prescription. Blood pressure needs to be monitored more frequently than annually in a client who is newly diagnosed and treated for hypertension. Clients are not usually placed on a 2-gram sodium diet for hypertension.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.